Alzheimer's, no, we don't have a cure so far. There's a lot of research going on in hopes to find a cure, but we do not have a cure. There's medications that help slow down the progression of the illness. For example, there's 3 different types that are cholinesterase inhibitors. These words are very difficult for us to say. So there's these cholinesterase inhibitors that help the brain communicate better. So you have nerve cells, right? The brain cells, and they communicate each other to make us do, talk the way that I'm talking, moving my arm, my hands. Everything that we do, our brain sends signals, right? So when you have Alzheimer's, that communication between cells is interrupted. So when you take one of these medications, whether it's Aricept, Exelon, or Racidine, these medications are going to help with the chemical that makes that communication possible. It's going to help that chemical be promoted. So with this disease, that chemical is suppressed. With the medication, it helps it communicate better between cells. Am I making sense?
Yes.
Okay. So then there's 2 different chemicals that help in memory and in learning. One of them is acetylcholine, and the other one is glutamate. So with cholinesterase inhibitors, you promote acetylcholine, and with Namenda, which is the 4th medication that is used, you promote glutamate. So that communication between cells is works. So there's 4 medications in total, not a cure, but at least we help the disease doesn't progress as fast once you take those medications.
And I think that's a really important point too, is that these drugs may slow down the progression of the disease, but the disease is still there and it still occurs, and the person still unfortunately passes away from the disease, but it may slow down the progression and increase their quality of life for a little bit longer. And of the 3, you said the Exelon, Aricept, and Racidine. Those are all in the same group, so someone wouldn't take all 3 of those, but they do have side effects. So someone may try Exelon and they feel very nauseous and they have trouble sleeping, so there are other options. That's why there's 3 of the same.
And also depending on the stage of your dementia, of the Alzheimer's, depending on where you are, there are certain medications for the beginning stage, there's another medication for the middle stage, and there's another medication for the later stages. Well, other than the medication, at this point, there isn't much that people can do. We do encourage people to keep an active lifestyle, because the more engaged you are, the more you socialize with people. It's better for the person. But other than the medications, I don't think there's anything else that would slow down the progression.
Yeah, like she's saying, there are lifestyle things that can improve your quality of life while you have the disease and the quality of life of your loved ones, but there's not really much you can do at this point.
To basically stop it, other than the medications. To slow the progression, not to stop the illness. It's a very an unknown field. I think that there's certain things that indicate that certain types of like early stage Alzheimer's would be hereditary. Early onset would be hereditary, but nothing is concrete yet. I think that there's a really good documentary called The Forgetting, in which portrays a family, a young family, a woman who was diagnosed in her, I think, early 30s or 40s, and she had 10 children. Out of the 10 children, 5 of them developed this disease. So, that leads you to believe, well, there is some sort of genetic component, but the research is still a little vague in what is a genetic component, and and there's families that have never had anybody in their family with Alzheimer's, and suddenly somebody appears with Alzheimer's. So we don't know for sure, but there's some inclination that at least early onset. Early onset is determined people who develop the disease before the age of 65. That's considered early onset. And so at least for the early onset, we see more of a genetic component than people who are diagnosed after the age of 65.
Yes, it can. And it is actually the sixth most common cause of death in the United States at this time, and fifth most common for people over 65. And so it is, and with that being said, a lot of times what's causing the death is complications secondary to the disease. So one thing that's common in the late stages of Alzheimer's is that people lose the ability to swallow, because the connection in your brain that tells your involuntary muscles to swallow is gone. And so people choke, or they swallow and things go into their lungs, and so they may pass away from pneumonia. Or a lot of times just different complications that come up. Your gait is affected, your ability to walk, and so people might fall and
break a hip.
break a hip and have injuries that are life-threatening.